refined the method a little, so we'll go by the question medium. So we'll try to hit on the most test important topics that are going to come in MRCP Part 1 from Psychiatry. So I would need your contribution, and little interactive class will be better. So we have a question here right in front. There are two questions from the same stem. Okay. So a 20-year-old man means quite young, is started on haloperidol, and we know haloperidol is an antipsychotic. So we are talking of an antipsychotic being given to a young man. So that means a diagnosis is already made and the treatment is also already on. So this question most likely would refer to side effect profile of the treatment given, or prognosis of the disease process, or the change in outcome after the treatment is given. So just from the first line of the question, you can make out what the examiner wants to know from you. A 20-year-old man is started on haloperidol each day for psychotic symptoms. So that means the diagnosis of psychosis is there, haloperidol as a treatment is there, and there is a young man. Which of the following side effects would most likely be seen in the first 5 days of treatment? Restless shuffling and pacing. 2. Mask like face. 3. Muscle spasm in the neck. And 4. Writhing movements of fingers and hands. And 5th is the rabbit syndrome. Any idea? So this question is about the side effects of haloperidol. And can you tell me what are the side effects of haloperidol?
Sudden jerky movements of the body,
Okay.
dizziness, tiredness,
So
nausea.
okay. So haloperidol belongs to which class of drugs?
Um,
It is an anti-dopaminergic class of drugs. That's clear. So it has got the side effects like difficulty with speaking or swallowing, inability to move the eyes, loss of balance control, mask like faces, muscle spasms, specifically of the neck or of the back, and restlessness, need to keep moving, which is called akathisia, shuffling walk, stiffness of arms and legs, rigidity. I mean, all the extra pyramidal symptoms that we read about Parkinson's. So we are thinking of haloperidol related Parkinsonism. Now, if I have to just bring it to your mind, if I have to bring it to your mind that this drug is basically causing Parkinson like side effects, then you have to understand mechanism of action is dopamine antagonist. That is okay. And in Parkinson's disease, where is the problem? It is the destruction of dopaminergic neurons in nigrostriatal pathway. So this means that these antipsychotics, which are dopamine antagonists, have a propensity to cause Parkinson's like side effects. So rigidity is one, tremors are two, but important is within the first 5 days of treatment, which problem will occur. So within few days, it is the dystonias which are more common. Dystonias occur within few days, within 1 week. Later on, there will be Parkinson's syndrome development or akathisia. Akathisia is restlessness and pacing. So akathisia comes a little late. That means week to months. So this is akathisia, and this occurs from weeks to months. Mask faces and rabbit syndrome, both of them are basically Parkinson's disease, and Parkinson's disease also occurs from weeks to months. As far as the writhing movements of fingers or hands are concerned, what are these known as? These are known as tardive dyskinesia. So, tardive dyskinesia, tardive means late presentation. Dyskinesia means uncontrolled movements of fingers or hands. This comes after years of therapy. Okay, okay.
Yes, sir.
So, haloperidol, being a dopamine antagonist, it has an effect similar to Parkinson's disease. It induces extrapyramidal dysfunction and extrapyramidal manifestations, out of which the earliest ones to develop are dystonias, which are usually seen in the neck or in the back. They are usually seen within the first week of initiating the therapy. When the therapy continues to be given, then the next side effects to come are akathisia, which is restlessness of the body, shuffling and pacing. So these are akathisia. Then from weeks to months they develop. This is the late presentation. Same way, other manifestations of Parkinson's disease like mask-like faces, like Rabbit syndrome, they all develop during the few weeks to months. This is the next side effect that will come. The third side effect of haloperidol and other antidopaminergic drugs, it develops gradually, and because they develop gradually, they are called tardive. Tardy means slow to develop. Tardy is the slow. It means slowness. So tardive dyskinesia means the abnormal movements of fingers and hands. So this develops most late, that is after a few years of therapy. So, given the knowledge that you just got, what should be the answer? So which should be the earliest side effect to come within the first 5 days?
Muscle spasm in neck.
Wonderful. So muscle spasm in the neck, and these are known as dystonias or the dystonic posturing. So this is the major side effect of haloperidol. So what is the treatment that can be given, or you want to shift from haloperidol to some other drug? Which of the following is least likely to cause the above signs? So we need to know the classes of antipsychotic drugs. This is pharmacology, and although they are also dopamine blockers, but they affect on different receptors at different sites, not letting Parkinson like or extrapyramidal side effects to develop. So I will help you here. The answer is clozapine, because these are the newer drugs. So clozapine, olanzapine, these are the drugs which are nowadays given in cases of acute psychosis or schizophrenia without having the inbuilt side effects of dopaminergic pathway inhibition. Is that okay? Yes.
Yes, sir.
So let's see the answer here. The various major extrapyramidal side effects like dystonia, akathisia, Parkinsonism, and tardive dyskinesia occur in a rather predictable time sequence. To precisely and reliably predict their occurrence is not possible given the individual sensitivities to different antipsychotic medications, but they have a potential to affect the D2 receptor blockade. D2 receptor blockage. So this is the receptor where they act. Now, dystonias, as I told you, occurs within few days. Akathisia, Parkinsonism, weeks to months, and tardive dyskinesia over a few years they will develop. If you want to take a snapshot of antipsychotics affecting uh, the side effects, you can take a snapshot of this. The second question was pertaining to which drug will have the least effect. So we just discussed that clozapine and olanzapine, these are newer drugs. So these drugs in the order of decreasing strength, this haloperidol has the most side effects of antidopaminergic, then thiotixin, chlorpromazine, thyroidazine, and the least is with clozapine. So let's visit the question again. Which of the following is least likely to cause the above signs? The answer is
Clozapine.
yes. So the answer is clozapine. If clozapine was not an answer here and olanzapine was the answer here, then olanzapine would have been. Okay. All right. Moving on to the next question. Very important. You will find this question in MRCP part one for sure. 110%. I'm telling you. Write it down. You will get it. So, an 84-year-old man with no previous psychiatric history is referred by an internal medicine physician for psychiatric evaluation. Over the past year, he has been successfully treated for prostatic cancer. About 2 months ago, his wife of 60 years died. He since has not been able to sleep at night but naps during the day. He feels lost in the kitchen and is unable to make a meal for himself, although he claims to have been quite efficient at working in the kitchen in the past. He forgets where he puts the things. He acknowledges being scruffy looking, unshaven, crumpled clothes, mismatched socks. On the mini mental status examination, he scores 26. He was unable to complete serial 7 subtractions and was unwilling to spell world backwards. He had little trouble with the language portion of the test. Which of the following is the most likely diagnosis for this person?
Major depression.
Okay, one answer is major depression. Anything else? Anybody else would like to opt for some other answer? Anybody else with a different thought?
Major
Come on.
depression.
This is not an exam, so you can come up. It will
Al-
help you clear the thoughts.
Alzheimer's disease because he is
Okay.
forgetful.
Okay. Alzheimer's disease is second. Anybody else with a different thought? Okay, let's see. Let's see. Alzheimer disease uh, is a very slowly developing disease. Very slowly developing. So slowly that sometimes even the family members they don't realize that the patient is going downhill. So this is just a 2 months ago problem because he has been fine otherwise. This is only since last 2 months since his wife has expired and he has become lonely and he is unable to take care of his stuff. Major depression is very close. Major depression is very close answer, but still the answer here is grief reaction. Because see, whenever such a situation is there, one must look for a cause. Depression Usually, the patient who is depressed doesn't know he is depressed. Hence, he doesn't know the timeline. He cannot tell you that I am feeling like this since this time. He will tell you, I am okay. I'm just not having appetite. I'm not able to sleep. But this person, actually, these are the stages of grief that he is going through. So, this is the first stage of grief, that is shock, then denial, to period of time when there is intense preoccupation with the disease. Person keeps thinking about the lost person, and hence there is preoccupation all the time. That is why he is unable to perform, uh, and is disheveled, is not dressed up finely. But yes, this goes very, very close to the diagnosis of depression. But honestly, as of now, it is not affecting his day to day life in the major sense. And after 6 months, if it still persists after 6 months, that is when we start calling it depression. So the time duration is also important, no? 2 months only. Okay? So this is why it is not depression. So this is just grief reaction. So the timeline is also not there. For depression to be diagnosed, we need a timeline of at least 6 months. Major depression. Okay. Of the following therapies, which of the following would be most helpful as the most appropriate initial treatment? Psychotherapy, electroconvulsive therapy, diazepam, thioridazine, or venlafaxine? So, logically, the answer here would be psychotherapy. Okay, so now let's see. These are all answers I have elaborated myself, so you might find a little, story uh, kind of telling pattern in it. So, although one would be careful to rule out other causes of this man's symptoms, the most likely precipitant in this case is the recent death of his wife. He has moved beyond the first stage of grief, that of shock and denial, to a period of time when there is intense preoccupation with the lost person. During this period, there are not only thoughts and dreams of the dead, but also fatigue, sadness, some withdrawal, and loss of interest in previously enjoyed activities. There are variable degrees of disorganization also, like he's not dressing up nicely, he's keeping he's unshaved and all. This is what is seen in this man as evidenced by his disheveled appearance, variable degree of disorganization. A score of 26 definitely on MMSC suggests no cognitive impairment, as one would expect if there was Alzheimer's disease. So, score of 26 is pretty okay. It is possible that at some point, if the grief reaction becomes pathological, he would develop a psychotic reaction or a major depression. So that is why it is, we give enough sufficient amount of time before a diagnosis of major depression is made. With adequate support, a psychologically healthy person would be expected to achieve normal resolution of the grief process. As far as the treatment of grief reaction is concerned, the most appropriate initial therapy is psychotherapy, in which he is allowed to share his feelings and reactions to what has happened. We just listen to these patients, nothing else we do. Care is given to avoid any anxiolytics because there is no anxiety here. Just missing someone, missing to the extent that he's preoccupied with the thoughts of that person. This may actually delay the resolution of grief process if anxiolytics are given or sedatives are given. Thioridazone is an antipsychotic. Venlafaxine is GS. It is an antidepressant. PCT is given nowadays only to people who are having suicidal intention, unless the course and severity of grief response deepens and indications for the use of medication are apparent. Is that okay?